So hello, everybody. Thank you for being here. My name is Angie Brown, and I'm actually the Chief of Staff for Union Institute University. And I am excited you're here. So this is our series on Lunch and Learn. And this month, we wanted to highlight May being Mental Health Month. And we thought, what a better place to highlight experts. And so we ask that feel warm, feel welcome to say and share, and we'll go ahead about everything. So first, if you guys can introduce yourself, that'd be great. We'll start from the end this way. So if you can just tell us your name, what you do, and how you get here, that would be great.
My name is Julia Saldana, and I am with NAMI Southwest Ohio. I'm the program director, and this is my 5th year there. Glad to be here. Thank you for having us.
My name is Deborah Wagner. I am a longtime NAMI volunteer. I was also a legal aid lawyer for years, specializing in disability law. And I'm currently on the faculty at Cornell University, teaching in the Yang Can Institute on Disability and Employment.
Awesome.
My name's Alex Grigg. I am an associate director with Talbot House, working in their outpatient Walnut Hills site. I've been working as a mental health counselor for the past 8 years, and prior to that was working in hospitals and residential settings.
So I'm gonna ask you guys to speak into the mic a little bit, even if you have to move it around.
Okay. Well, hello, everybody, and welcome. I'm Dr. Becky Morrissey. I am the director for the Graduate Clinical Mental Health Counseling Program here at Union. Glad to be here today.
Hi, my name is Jennifer Parham, and I am the coordinator of Hamilton County Services for Child Focus, which is a mental health agency. I serve all of our Hamilton County and oversee all of our Hamilton County services. Been with Child Focus 13 years now.
Hi, my name is Rebecca Jones. I'm Associate Director for Talbot House, and I am over all things prevention in Hamilton County. I have 10 different programs that work out of my office. We have everything from the fatherhood program to the mental health hotlines that ring in, so 281 CARE and the 988 hotlines that have been publicized lately. And we've got over 100 staff that do that. And personally, I've been involved in prevention. I talk with my hands. I need to keep them under the table. Sorry. I've been involved in prevention. I started my professional career in prevention in '99. So I've been around in the field for a while.
This is really great. Thank you guys so much for being here. I do appreciate it because I'm going to learn a lot today. So when I think of the word mental health, of course, so many things come to my mind. And there are some biases that I may have, some unconscious biases. There are things that I just don't know. And I talk with my hands too, so it's okay. So there are things that I just don't know. So it's really great to be able to have a conversation with professionals. I will tell you that the conversation is being taped, so you guys know, and being Zoomed, that other people are probably watching it at the same time. So my first question for you, and we can start whichever way you want to, and everybody can answer this question. What is mental health? And I won't pick on Dr. Morrissey because I know her, but Dr. Morrissey.
Oh, you want me to go first? What is mental health? Okay. I think mental health is something that's still being defined. It's still, it's a way of relating to each other. It's a way of relating to norms. It's a way of relating to our future and to our past, to ourselves as society, and also ourselves as individuals. I've been in the field 25 years, and I've always been in dual diagnosis settings. And so when I think about mental health, I think of it as a way of someone living the best life, but also living in a way that they can integrate what's happened to them in the past, integrate who they think they've been in the past, and bring that to something that allows them to have a future that is healthy in the way that they define that. Maybe not necessarily as a clinician defines that. So I kind of thought the first question was going to be, what is mental illness? So I was a little bit more prepared to talk about that. But I think that mental health is a term that we are defining as professionals today.
I agree.
And our clients and patients are also defining that as well. So it's an exciting question to me.
Thank you. Anybody else want to talk about it?
Think she did excellent. I do. I think I like the fact that you said our clients are defining it, because I think there was a time and a place where clinicians defined what appropriate mental health was versus mental illness. And I think we're now opening the doors that if you define it to be that you are not functioning where you would like to be, whether or not that's diagnosable, we are now classifying that. So I do think it's exciting because we're having clients coming in that we're seeing that are able to identify, even though I may not fit a criteria, I still want to function better. I want my wellness to match my physical. We put a
Mhm.
lot of, I feel like we put a lot on physical well-being. And so my knee hurts, I'm gonna run to the doctor. Even if there's not a diagnosis, I get physical therapy. And now we're seeing people do that with their mental health.
Yes.
I feel a little bit off. I just want something to help. And they're no longer being afraid to say, I'm not worried about the diagnosis. I just want to improve my overall functioning. So I like where you were coming from a lot.
And I'll say, I think both of those are great. Oh, sorry, I'm not used to not being loud enough. I think both of those are great. I'm not a clinician, so I don't look at the diagnosis part. And so I think for everyone, it's that point of feeling okay with yourself and where you're at emotionally and physically. And in my field, we talk a lot about mental, emotional, and behavioral. And if all of those things are working together for you or not, then it's not just about a diagnosis or these things that they've said, this is when there's a mental illness or this is when there's an issue. If you're feeling like things aren't okay, then things aren't okay for you, regardless of what somebody else is gonna say. So it's like in my group, we talk a lot about taking care of your mental health, right? And we talk about if you feel like something's off, you need to say something, because our society is great about talking about take care of yourself. You know, they talk about self-care, but then they always talk about like bubble baths and massages, and that's not what it is for everybody. Like to care for their own mental health. I know lots of people that I need a break, I need a time out from whatever I'm doing to reset and refocus and let all those chemicals in my brain that come out when there are stress chemicals going on relax so that I can go back to enjoying and engaging and not feeling that pressure inside my body while I'm doing it. So I think it is this kind of enigma that's so different for even each person, because I know like we joke in my family, my mom fusses because when we talk about taking care of your mental health, she's like, do not get another piercing or another tattoo. And I'm like, but I have to do what works for me. And she hates that. But for her, I'm like, go, she goes and walks in the woods and things like that. So I think it's very different from each person when we talk about taking care of your mental health and what it looks like for an individual. It's not necessarily what it's going to look like for the next person, but it's more about how they feel.
And I was just gonna add that I think it changes over time for people. So one time my son has bipolar disorder. One time he was going in the hospital and they said, what are your goals for treatment? He said, I want to be able to take a shower and get my mail. For him, where he was right then in his depression, that was wellness. Now he's in college full time and getting a 3.5 in engineering. So that definition changes over time. And he has good periods where he can do more. And he has periods where he understands that maybe he can do less, and that's still okay. And he's always working towards mental wellness and the next step for him.
And it's great that you point out that it changes over time, because even the little tiny ones, because we work preschool too, they have those days. Like I've always told schools, because I worked in the schools for years, and they would expect first graders, you have to show up ready to work and learn. Well, when mom and dad had a fight that morning and I heard it and I'm upset, I can't sit and focus in the classroom and learn what 3 + 5 equals, because my brain is still over here. And so it is something that we have to address completely across the ages, because the little ones deal with it very differently than adults or even seniors. Like there are stages to it, and learning about it as you go along is very important.
Yeah, the only thing I'd like to add is that we all have mental health. We do not, I mean, just like we all have physical health, we all have mental health, and it's basically the health of our brain. So it changes over time. Like Deborah said, it changes from person to person. For a person with a mental health diagnosis and a more serious one, it might mean getting out of bed and taking a shower. For a person with a less serious mental health diagnosis, it might mean showing up to work every day. And for a person without a diagnosis, it might be, reaching a goal at a certain level. So it really changes from time to time and person to person. And we all have it.
Yeah.
And we all have our good and bad mental health days. So something for stigma.
And the part that I would add is we do often talk about the discrepancy between physical health and mental health, but oftentimes mental health can seriously impact physical health. Chronic effects of stress, chronic effects of depression, anxiety can have a very serious detrimental effect on our physical health. So I view mental health as a spectrum of everything that's not our physical. So our feelings, our thoughts, and our actions. And there's a spectrum of things that we can do about it. There's treatment if our mental health is poor. There's maintenance if our mental health is doing well. There's prevention efforts that can prevent us from going down a path of having negative or mental health.
So thank you guys for that. So I kind of want to go back a little bit, and I love what you said about the fact of the matter is that it changes. Somehow we could be at one stage of our life and things could be going really well, and then all of a sudden, what happens? And so how do we pivot from that? I mean, how do we say it is okay that I reach out and say, you know what? I need some help here. How do we do that? Because the majority of us, the norm is you'll be all right. Just keep moving. You'll get through it. But how do we stop that stigma to say, you know what? The arthritis in my knee is hurting really bad today, so I'm going to the doctor. Okay, call the doctor. But if I say, hey, something is off. So how do we begin to, I know conversations like these, but how do we, all of us, including all of us in the room and on Zoom, how do we say it is okay to reach out and say, things are just not well right now?
That's $1 million question.
That's why I got $1 million panel here.
I think the first thing that comes to mind for me is my background's in DBT, and we love
Now
reality.
you gotta tell us all what DBT is.
DBT is dialectical behavioral therapy. It is a therapy that's really based on skill learning. And so we teach skills in the belief that you are capable. So it doesn't have an overarching belief that there's something wrong with you. It is, you're just lacking some skills. Let me teach you some skills. It'd be no different than if you wanted to go into cosmetology. On your first day, you're going to learn skills. And so DBT has a belief that you accept reality as it is. And in order to do so, you accept responsibility for your reality. And so I think we have to accept responsibility in our own lives to how am I acting day to day around the people? Am I validating their concerns, or am I making them feel like they can't go get help? It has to start individually, because until the people around you see that you believe it, they're not going to transfer that knowledge. And so I think, of course, as agencies, we do, things, I'm sure every day we're in legislation with Child Focus. We're going up to Columbus. We are trying very hard to destigmatize mental health. But if we're talking about who's in this room right now, I would say, are you looking in the mirror every day and asking yourself, when someone comes to me and says, I feel off, is your response, do you need to talk to someone? Or is your response, I felt off before too, you'll be fine.
And that's good, because I've tried to be very honest. If somebody say, hey, Ange, how you doing today? If it's a day that I really don't feel that great, and I say, I'm just not doing too good today, I get a lot of kind of like, oh, and I think it just kind of stops there, because we don't know what to say unless you say, oh, I'm great. And it's like, okay, but how do we, as you said, we need to have those conversations that it is okay not to be okay.
And I think the younger generations are getting that. They're much more open to those conversations.
Oh, yes.
And I know like social emotional learning causes a lot of people to go, "Ugh," when they hear about schools, but kids are getting it, and they can say, I don't feel right now, or I need to take a break, I need a time out, or my brain can't stop, and they can express it. I have in my house right now, I have a 16-year-old, a 14-year-old, and a 10-year-old. And part of it could be who their parents are, but all of them have done the thing of saying, hey, I need to take a break. I need a mental health day, my brain cannot handle it because I'm thinking about these other things. So I think a lot of that is just talking through that. And the other thing is making resources available. So like here in Hamilton County, we have lots of
Mhm.
resources and we're very blessed because there are other counties that don't have nearly the amount of resources that we do. But even with that, there are times that like, we know each other, I may not be comfortable because she's too close, right? And that's one of the nice things. So I happen, since I said I happen to oversee the hotlines, it's nice to have that person on the other end of the phone that doesn't know you, that you can call and talk to. So 513-281-CARE is a number of people can call and they can talk to somebody 24 hours a day, 7 days a week. And they talk through, I'm having one of those days. And we have
I
people
want,
that
I
call
want
and
you
say
to
that.
slow down and say that number
Okay,
again.
sorry. Gotta remember, I know. 513-281-CARE, right? 281-CARE is one of the numbers. The other number of 281-CARE is too long to remember, is 988. Now, 988, when they answer, they'll answer it as the suicide line. However, they will talk to anyone about anything. And that's the big thing, the big message we keep pushing with it is that you can call and we're not gonna hang up on you just because you say, I'm concerned or I'm anxious or I'm worried. Well, are you suicidal? No. Okay, well, we're still gonna talk. It's not gonna be, okay, well then, sorry, I can't talk to you, click, like, that's not gonna happen, right? But to allow people that time. And then we also have a group that calling on the phone is a problem. So our 20-somethings, they never call people, it's always a text, right? So here in Hamilton County, we also have 741-741 is the text line that anybody can text and they can just say, hey, and then somebody will respond and talk to them for as long as they need, because there is that thing of, if I say something to somebody that I know, then they're gonna know that I said that, whereas if you have somebody else that you can talk to that you're not connected to, it can make a difference.
So how do you all, what do you all do to make it normal, to make it okay to say I need some help?
So I have to say, my son was diagnosed at 4. So I grew up, he, through his entire childhood, he had mental health issues. And so I started normalizing talking about mental health and how we're feeling and what I was doing for my own mental health. So I don't have a diagnosed condition, but I'd come home and I'd say, today was really frustrating. I think I'm gonna go for a walk. Because when I go for a walk outside, I feel better. Or today, I just feel really low energy, so I'm gonna spend today in my pajamas, and that's okay, I can do that. And what I've discovered is that having those conversations with him, I've started having them with other people. And so whether I'm at work or just out in the community or talking to my friends, I'll talk about how I'm doing and what I'm doing to help myself to feel better. And that opens it up for other people to feel like there's a safe space for them to share how they're feeling and what they need to feel better. Do you want to talk about some of the other things NAMI does?
Yeah, in fact, I've learned a lot from Deborah about self-care and how she models her behavior. What we do in the community, and you're right, our younger adults, our teenagers are really good about talking about mental health. I think we need to do more to normalize the conversation in, maybe older, like the grad students and above, and especially in the workplace. So normalizing that conversation that it is a medical condition, just like we might have a backache one day or our arthritis might be acting up, and our 20-year-olds have arthritis, so it might be acting up on one day. Our anxiety might be at an all-time high one day. The fact that it is a medical condition, there are medical doctors who treat mental health conditions. They have an MD with a specialization. There is recovery. There are people who live with serious mental health conditions, like my daughter, who also lives with bipolar, Deborah's son, and a lot of the volunteers we have who share their stories, who live with serious mental health conditions and who are doing very well in school full-time, working full-time. So having those conversations and being that message of hope and recovery, and also the reality that it is tough. You have to work at it every day. And also admitting that we have bad mental health days. I live with anxiety that I didn't realize I lived with for about 25 years, until, my daughter modeled that behavior of getting help for me, and then I got help. So So that's what we do. We go out into the community and we present those shared stories and resources.
Dr. Morrissey, so I'm gonna call on you again. So what do you do to your new students who are coming into the program? How do you allow them to know that it is okay to normalize this conversation?
I think that starts at the application process.
Okay.
Many students without, or applicants without really even being asked, will put in their application essay all of the things that we've talked about at the table so far, why they're here. And they're seeking answers for their own growth. They're seeking answers for family dynamics. They're seeking ways to help others from having the life that both of you have described. I think education, as we know, is a powerful force. Education around mental illness, mental health, removing stigma, I think comes from knowing. And I think one of the best ways is to actually know an embodiment of these things and say, I know someone, I have someone close to me has these things. So I think many of our applicants come into the program, they're working in the field and they say, I want to have a licensure so that maybe I can, my contribution can be expanded through that licensure. And so that's one way. I think another thing that comes to mind in talking about that is education in the span of time that I've been working in the field has changed right along with digital intelligence, I'll say, digital empathy, lots of different ways of connecting through the media, but through digital knowledge and digital intelligence. I mean, I have a fourth grader who will talk about having a mental health day. I didn't really teach her that. She might have heard her father and I talking about it because we're both in the social work mental health field, but she understands what that is from what her school has taught her. And they're teaching her to understand that this is a day-to-day thing and that speaking and out for support isn't a matter of competence as much as it's a matter of connection. And if there's anything around mental health and mental illness, I think is really important change. We talked maybe about older generations who maybe got different messages growing up, is that it's not as much about competence as it is about connection. That's one thing that I'm seeing that is changing in the workforce and in workplaces as well. It's growing. I think the understanding of it is growing, as well as other coping skills that are healthy coping skills.
Alex, so in your field at the Talbot House, I'm sure you see huge, a vast difference of people who walk in the doors and those who are referred to the Talbot House. How do you deal with allowing them to know that it is okay? Come on in.
Sure. Because a lot of times when people come in, they might be scared. They might have said, I've tried everything. I've been a whole bunch of different places. Nothing has really seemed to work, or maybe something has seemed to work in the past. So starting off with the conversation of, we're here for you, we're going to be here for you. Just providing that consistent, reassuring support and unconditional positive regard of, you're valuable, you are valued, we're going to do our best to help you however we can. And really starting the conversation there, and also giving clients a chance to determine what their own measure of success is going to be. One of the first things that we talk about is, what are your goals and how can we help you get there? Because if we are trying to pull in one direction and the person is trying to pull in a different direction as far as what they want to see, we're not going to get anywhere. And in some cases, we might actually make things worse. So starting off with what their idea of what a healthy, functional life for them could look like. And obviously, we give some input and try to make goals small, incremental, measurable. That's typically where we start is, we're glad you're here, we're going to help you. What is it that we can help you with?
So what do you all do for the marginalized community? Sure, there's a huge community that has no idea. Everyone has either been misdiagnosed or just kind of left to their own, how do you reach the marginalized community? And when you reach them, what do you do?
So at NAMI, we actually do a lot of outreach in the community. So we go into the schools, we talk to people in businesses and nonprofits. And Julia's done an amazing job of increasing the number of groups that we work with. And then carefully picking the people who go into those communities and talk. So sometimes it's really nice if they're hearing from voices that are familiar, seeing faces that are familiar when talking with marginalized communities. And so Julia's done a great job of connecting just the right speaker from NAMI with just the right organization to talk about that experience. So to give you an example, we just went and did one on the West Side, and West Side has a reputation. We don't talk about mental health on the West Side. And so Julia picked a young man who grew up on the West Side, went to school on the West Side, who lives on the West Side. And he was talking to this group at this church about how he played Little League on the baseball fields out back. And instantly they felt connected to him and they were ready to talk to him and be really open with him. And if we hadn't had that connection, I don't know that that community would have opened up the way that they did. And so it's constantly having those conversations, but thinking critically about the fact that stigma is different in different marginalized communities. And we have to recognize that, and we have to respect that, and we have to work with that.
That's great. Anybody else want to?
I think for Child Focus, we will come find you. And I know that that sounds a little bit creepy maybe, but the truth of the matter is if there's a section of Claremont, Hamilton that we're like, why do we have no clients from this area? What's going on? Then we're gonna go. We're gonna figure it out. And one thing that I love, our current CEO was my supervisor. And I tell her all the time, she raised me in mental health because I think as a clinician, you get raised, you have to learn. And something she taught me 15 years ago when I first met her, before I walked in the door, is we don't say no. We say, what do you need and who can help you? And so that has been our attitude at Child Focus, and mine personally is I am not afraid of the label somebody else has given you. And so if you walk in the door, I will find a way. And it may not be me, it may be you, or it may be you, but I will find you someone. And so I think what we need to do with marginalized groups is, one, we need to identify, if I don't know how best to treat you, I will find someone that will. I will walk you through the process. I will not leave your side. I will not hand you a number and say, hey, call this. I will say, come into my office, let me find somebody for you. And so I think what they're doing is amazing, is they're finding how to match. If I can't do that, then I'm gonna find someone like them that can. And so I think one way is you have to be willing to admit, I don't know enough. You have to be willing to ask questions. You have to be willing to be very uncomfortable, and allow people to teach you what you've done wrong. With marginalized groups. And then you have to also be willing to say, moving forward, I'm gonna do this better. At least in my experience.
I think that's great. When I think about it, a lot of households now have intergenerational people that are in the home. So if I thought about my father, for instance, he would say, you don't need to talk to anybody. Why? I mean, we don't do that. We are
Right.
not, you don't tell anybody your business. You deal with it.
Yeah.
And then I look at my adult children who are, as you said, it's time for a timeout. Mom, this is just too much. And so I'm balancing in between what I've heard growing up and what I see.
Yeah.
I like what I see better. But then it also leaves me in the middle to say, okay, what do you do? How do you do this? And so I find myself very vulnerable where I'll say, I didn't cry today. Because I'm used to yeah, and nobody to talk to about it because you're not supposed to do that. How do we make that normal that, you know what, Ange, you could cry, it's okay. How do we tell people that? How do you say it's okay? I mean, you don't have a sign and board walking around, hey, it's okay to cry. But I love what you said, finding those match with the people. How do you find the people for somebody like me that's in that generation sandwich that's saying, is it okay?
I'm sorry, go ahead.
No, go ahead.
No, I think the way we do it is, and I say that we have, and I'm sure all of you all do as well, some of the best volunteers. We have an example here. But learning them, listening to their stories, so that when I get a request from a community that is looking, a faith community that might be, okay, you deal with mental health by praying more.
Yes.
I have, somebody like Naisha go in there, who is the daughter of a pastor who was told to pray it away, but now she does pray. She's still very religious. But at the same time, her line, which I love, is God made therapists and psychiatrists to be to help us through him. To help us so that he can help us through them. Okay, and I love that line of hers because she's not given up her faith. She's true to her upbringing, but at the same time, she's doing what's needed, right? So listening to the stories and listening to that and, preparing them and saying, okay, this is, I think, what they want to hear, or something like this, so that, we are ready. And also all our services, and I'm sure for most of us, they are available at no cost, so that, when somebody is waiting for that appointment, for that right fit with a psychiatrist or a therapist, all the nonprofit services are like, a bridge and also an additional support later. So they don't have to worry about cost when their anxiety is at a high, and, at an all-time high.
Skip,
So,
I'm glad you
yeah,
said that. Like,
yeah.
we don't worry about the cost.
And I think as professionals, we also have to realize, because we say it a lot, we need to find the best person for someone, but then to realize and it be okay that may not be me. Like, I can't walk into everybody's house here in Hamilton County and them be okay with it. I may feel okay with it, but it's not about me. It's about them. And so as professionals, it's finding the people, because you're more likely to talk to someone who looks and feels and was brought up like you. So finding those key people in those different communities that are those stakeholders that care, that have the experience, that want to make a difference in their communities. Because rather than me being the one to go in, can I partner with that stakeholder, help them get whatever training it is they need, and then empower them to reach out, rather than it always being someone that looks like me doing it, right? Because it's key to connect with people where they're at, not where I'm at as the professional.
Anybody else want to answer that one?
In terms of working with people coming from a different cultural background, different upbringing, different anything like that, a lot of times, one of the first things that I would say is, you are the expert on you. I am not the expert on you at all. I am not here to tell you what to do or how you should do it. I'm interested first in learning about where you come from, what sorts of things you believe about just what we're doing here. If you're coming in saying, I'm not sure about this whole counseling thing, I'm not sure about this whole case management or medication thing, that's totally fine. We can work with that. We can talk with you. We want to figure out what is going to be the best fit for you. Because it is great when we can find a really great fit. That's not always necessarily the most practical thing if somebody's needing help right then.
Right.
So starting off with, you're absolutely right. I don't know what you've been through. I don't know where you come from or what you heard your parents say or grandparents say growing up. Please help me understand. Tell me what you've been through. And sometimes even just being given the chance to talk about what they've been through can be really powerful.
You want to say something? Okay. So I'm going to ask you guys to give me a commercial. Help me. Tell me, what would you tell everybody that's listening on Zoom? What would you say about mental illness, mental health? What would you say to people to get them to realize that it is real and we do need to have a healthy self, a total self? So we'll start over here. Yeah.
No thinking time there, right? So I think for me, when I look at it, I want to tell people, you are totally and completely you, and the resources we have are to help make you the best version of you that you want to see, right? Because so many times people try and fit in other people's boxes as far as what they should be, what they should do, and what their life should look like. But you have to define that for yourself. And then mental health comes in because as you do that, what are the ways that you keep yourself going and you keep yourself in that state where you can be happy and healthy and not feel stressed out all the time? I think there are times like in our society, like we wear stress as like a badge that we should have earned because, oh my gosh, I was so stressed at work today, right? But that's not how we were meant to live. Like, that's not how our bodies are designed to function. And so the goal is always to help you as a person be the best you that you can be and live the fullest life that you can. Good luck.
I know, I was listening to you and I was thinking, I think one thing that I would love to see is I have noticed there are increasing commercials about mental health. I still think they depict, for lack of a better term, the worst of the worst. You know, you see these mothers that aren't getting out of bed. I would love to see a commercial of somebody that goes through their entire day and looks 100% normal, is smiling the whole time, accomplishes everything they want to accomplish, and then at the day just looks tired. Because normally that is how mental health will first manifest, is little tiny things. And I would love for us to reach a population of people that are sitting there going, well, I don't cry myself to sleep and I don't feel overly anxious, and you know, I'm just tired, or I'm just exhausted, or I've lost a little bit of, my niece says, my starlight. I've lost a little bit of my starlight. Because I would love to see it normalize that even that level is okay to say, I don't have to live this way. I can ask for more and for better. Because like you said, I do 100% believe my parents' generation wore stress, anxiety, trauma as a badge. And that badge was, I'm fine and I did nothing about it. So you should be fine doing nothing about it. And I would just love to see a commercial of mental health that is just a very typical, boring, normal human being that at the end of the day was like, my health, I'm really tired. My health shocked somebody.
I like those thoughts. I think what, as a clinician, because I'm still in clinical settings as well as in educational settings, one of the things that I've noticed is that a lot of times people do not get mental health help until something catastrophic perhaps has happened, or until they have what I like to call external motivation to go, which means someone is wanting them to go. That might be legal, that might be family, and there's usually consequences if they do not come to services or to help. And one of the things I have always thought of is, if there would be a way to encourage people to think about getting support and connection, even if there's nothing drastically amiss in their lives. And that, I think one of the best ways to do that's with groups. Groups give a voice to the things that people are feeling and thinking. They can go to a group and not necessarily talk about that, but just be part of the support there. Or they can go to a group and say, okay, I have some things I'd like to say. So peer-run groups are wonderful. Having more accessibility to groups that might have a clinician as just some kind of a someone protecting the process, someone ensuring that the process is safe for everyone. Those are really great ways to work on mental health questions, not necessarily, do I have a diagnosis, but just, does anybody else feel this way? And they'll find, yeah, everyone feels this way. Okay, I thought it was just me. And that, I think there does need to be some cultural competence underneath those kind of services, so that there's some understanding about how best, what language to use, what words to use, how to reach populations that need some time to trust first before they dip into something, even like a group, but certainly like something like individual services where maybe they can have that good cry. So that's what came to mind for me.
In my work and my counseling, a lot of times we focus on the beliefs that we have about what we value. So in terms of making a commercial, it would be focusing on the fact that your value does not depend on you being okay all the time. Because we can get easily caught up with that, and that's one of the biggest barriers to seeking any sort of help. And to everybody's point so far, it doesn't have to be there. I have to be able to have a label to it. I have to be able to have a name to it. I have people that I work with that are making great progress, and they don't refer to themselves by their diagnosis, and they absolutely don't really particularly enjoy the labels, and that's totally fine, because that's what they're choosing to find worth in themselves, not necessarily being okay for everybody else or for themselves.
So my commercial has kind of almost been done. You guys have all seen the commercial where the woman runs around all day with the smiley face mask because her depression
Yeah.
treatment isn't really working. And I just have to say that my son has perfected the art of wearing a mask when he's not doing well. And it is exhausting. It is devaluing. He will come home and just fall apart at the end of the day if he's been wearing that mask all day, because that's really hard to pretend to be normal, whatever that is, all day. And so I would love to have a commercial where they talk about taking those masks off, and as a society being okay with each other, just being ourselves and being vulnerable. I think that would help reduce the stigma. I also think it would help increase empathy for those of us who normally experience mental wellness, to understanding people who may be struggling and may feel like they have to wear a mask.
Yes, my commercial would be, if you are experiencing bad mental health day or a mental health challenge, you are not alone. Recovery is possible. There is hope.
Yeah, thanks. Thank you. So do we have any questions in the audience you'd like to ask? Can you come up and you can take my microphone just so that everybody can hear you? Sure. You can introduce yourself.
Thank you. My name is George Sahi. I'm a former college professor, college dean. My experience has been with higher ed kids over the age of 18. My question is different. What I'm going to ask you is this. When you look at mental health, you look at different culture, parents coming from different countries, different languages, especially in America. And sometimes when people come to you, it's too late. What word of advice do you have? What are the 3 things that parents need to know to detect the problem before it happens? Just 2 weeks ago, a friend of mine found his son dead in the basement of his house in Detroit, Michigan. 6 months ago, a friend of mine came home and his son was not home, and he was found in Pennsylvania. And both parents said, we had no idea what was going on. So what advice do you have for me? I don't have small children, but I'm the grandfather. So what would you tell me? How would I know that my child has got an issue so I can nip it in the bud and deal with it before this escalates?
Well, like I said, my son was diagnosed at 4. So I'll tell you a little bit about how that happened, so you'll know what that looked like. So when he was 4, he started having what looked like temper tantrums again. And I was like, wait a minute, we outgrew these. Why are we back here? But they started interfering with his ability to do things he wanted to do. So he didn't want to go to the playground because he had a headache. He didn't want to go over to his friend's house because his stomach hurt. And so I started really paying attention to the behaviors that I was observing. And I realized he doesn't look angry when he's having these tantrums. He looks scared. And I had no clue what was going on. I was like, something's wrong. But, he was running out into busy streets. It was really starting to be a dangerous situation. So I just went to my pediatrician and I described what was going on. I'd taken notes. I talked about how often I was seeing it, exactly what I was seeing, exactly what he was saying and doing. And she was the one who diagnosed him with panic attacks. And I was shocked. Who knew a 4-year-old could have panic attacks? But I think it's the listening, the observing, the noticing changes, And I get it. Like, I cannot tell you, my son was fortunately in therapy his entire childhood. And I cannot tell you how many times I said to a therapist, okay, is this age appropriate, like normal behavioral changes, or is something happening? But now my son is 24 and I know that he's in crisis when he withdraws from me. So he doesn't have contact with me. I start getting either one word texts from him, or I get these really long rambling texts from him. And he's not doing the things that he would normally do. So his friends will text me and say, we were supposed to get together tonight. He didn't show up. And that's when I know he's in crisis and I need to find him and I need to get him help. But part of it is the normalizing that conversation. You know, part of why my son and I can do this is because we've been having this conversation since he was 4. One time his friends called the police for a welfare check in the middle of the night. And when I got to the door, he was already talking to the police. And I turned to him and I said, are you suicidal? Do you need to go to the hospital? And he said, no. I said, can you contract for safety? Can you promise me you're going to stay safe until we can call your doctor in the morning? And he said, yes. And the police were like, my God, what's happening? But it's because we knew how to have these conversations with each other. We had common vocabulary and we talked about it all the time. And I talked about it as well as listening to him talk about it.
But I'm trying to be devil's advocate here.
Yeah.
Not everyone has got a mother who teaches at Cornell University. Okay. When you look at the common people out there, they have no idea. Like two of my friends, these are engineers, and they said, I had no idea. So what I'm asking you, be specific as, when I see this, do this.
Well, the behavior looks different in anybody,
Yeah.
but anytime you see a significant change in behavior, in energy level, if somebody is especially for suicidality, if somebody's talking about death, if they're giving away possessions, if they learn the warning signs, and there are warning signs, we talk about them all the time.
The risky behavior.
Risky behaviors. I had one friend who he'd been really, really depressed, and one day he was really happy out of the blue. And I thought, this is a change, something's wrong. I was 13 and I went and told a teacher, and I was right, he was suicidal. So learning those warning signs, I think everybody should know those warning signs, just like we know first aid, like we know what to do if our kid's choking, right? We know how to clean and dress a boo-boo. I think parents need to also learn the warning signs of mental health, and especially around suicide, because when you know those warning signs, then, not always, but then sometimes you can catch when something changes. But even if it doesn't, it's really important that people know it's not their fault. Even, you know, if you know the warning signs, you're not always going to be able to catch it.
So I want to piggyback off of Dr. Sahi. So you said the cops were at the door and now had that been a black young man
Would be different.
at the door, it probably wouldn't have come out like that, whether they knew to talk about it or not.
100%. And my son and I talk about white privilege all the time and what that means, that his friends can call the police when they're worried about him, that I can call 911 when I need help getting him to the hospital. And when I'm working with NAMI, it's something that I do a lot of family support. So I do family support groups. I do peer support for other family members. And especially if during the pandemic, I'm talking to people on the phone, I've never met them. And I would say, how do you identify racially? How does your child identify racially? How do you feel about calling the police? If not, let's talk about other options, right? Because I recognize that is all of the white privilege in the world that allowed us to be able to have the police come to our home peacefully and assist us rather than endanger us.
So I'm gonna take it that your son is probably a person of color too, right?
No,
Not, it's a,
just the Caucasian.
and nobody he hadn't had any help at all.
So,
Apparently, no.
so I will interrupt for a second. I'll say, first of all, I'm so sorry for your friends and that they experienced both of those situations. The thing I would say on the other end would be, A, the parents need to realize it's not their fault if they didn't catch it, right? Because so many people go into that thing of after something happens, they want to blame someone, and lots of times they blame themselves, right? There are warning signs. However, I've also talked to lots of suicide survivors who will say, I hid it on purpose, right? So the first thing I would say to a parent that says, what should I do? I would say, spend time with your kids that's not with them with any type of electronic, because lots of them stay on those electronics. The second thing is, especially with that age group, monitor those electronics, right? Because they will talk to their friends before they talk to anyone else. Or if there's an issue, because we hear about kids being bullied and other kids saying, well, do this to yourself or do that. Parents can catch some of that if they're monitoring their stuff. Like I said, I have 3 kids at home. I have a 25-year-old also. We monitor their electronics. When they get a new app, when they get a new message, things like that, it goes into a thing that I can check, right? And then sometimes it's asking those hard questions, right? So if you see that a behavior has changed or there's something different, asking them and saying, I want you to tell me whether you think I'm gonna like it or not. And I'm not giving you consequences for it, because I just want to hear where you're at, because I'm concerned about you. And it's the hardest question you can ever ask your kids. My 14-year-old was coming out of school earlier this year and she didn't look right, like something looked off. And I said, do you want to talk? And she said, no.
Yeah.
And I'm like, are you sure? And she just shook her head, which is not like her because she's a verbal one. And I looked at her and I said, Maya, are you thinking about hurting yourself or somebody else? And she just burst into tears, right? Something was off. She was having suicidal thoughts that day in school and she didn't know what to do with it. But had I not asked, she told me later, she wouldn't have said anything. She would have gone home and gone up to her room and been there all evening with those thoughts, right? So what I tell parents is, parents are not perfect, just like our kids are not perfect, right? We're gonna miss stuff. But having the consistent conversations and the open conversations where you listen and let them tell you, this is what I feel like is going on, this is what's frustrating me, this is what pisses me off, is okay for you as a parent to listen to and to let them share that, because the relationship can change over time. It's not like you're dealing with one that you're controlling lots of their actions as they get older. So you can become a parent that is still that understanding ear for them to come talk to, that isn't going to penalize them for everything. So that's what I tell parents, is that A, you might miss stuff, listen to them, talk to them, monitor them, and ask those hard questions if you need to. Does that make sense?
Yeah, makes sense.
And I would like to add just one thing. Every time my son tells me something serious like this, I always thank him for telling me.
Yes.
I always say,
Yes,
thank you so much for
100%,
sharing that with me. I really appreciate you telling me.
I would also say there are, I mean, I know that we do, you do, I know NAMI does. There are lots of agencies that will provide parents with support.
Yeah.
If you have people in your community that don't know how to ask these questions, go to your local agencies. I know the Child Focus, we do seminars all the time for parents, and we walk them through how to ask those questions. And so I make it a practice in my life, if I'm spending time with my niece or my nephew or my best friend's kids, I will randomly in the middle of it be like, hey, have you had any thoughts of suicide lately? And they're always like, no. But I would rather ask that question over and over and over, and they know I'm not afraid of it. I'm not afraid of it.
And my point was, before to get to that point,
Right.
I want you the parents to be aware of like what you said, change behavior. So
Mhm.
thank you.
Yeah.
Yes.
The statistics are, I believe, 80 to 90% of deaths by suicide are due to a mental health condition. So knowing those warning signs for a mental health condition, which is isolation, change in behavior, sleeping habits, eating habits, drop in grades for students, or productivity. And this actually change, I won't say drop, change. It could be somebody who is doing too much. That can be a sign of mania. Like when my daughter took on 4 theater productions in one semester in high school, looking back now, I know that she was probably going through a manic episode, even though she didn't have a diagnosis then, right? So knowing those warning signs, risky behavior, alcohol and substance abuse. What else? What are the STEM conditions? Inability to focus, panic attacks, anxiety, right? Am I missing anything, Deborah, from our 2 slides?
I was gonna say excessive worry
Yeah.
and rumination.
Right.
And, you know, we all have a bad day, right? So we all go like, oh, shoot, I had that last night. I was really, but we're looking at duration,
Right.
intensity, and looking at whether or not it's interfering with activities of daily
Yeah.
living. And that's when you really become
Right.
concerned. Because
If it's more than 2 weeks,
Yeah.
right? Yeah.
Thank you. Appreciate it.
Thank you
Thank
all.
you.
Is there any other questions? If you want to come, if you project your
Yeah, gotta be
voice,
loud.
yes.
I'm Fatima. Thank you all so much for this really informative panel. I think, what wasn't necessarily clear in all of our discussions is the difference between mental health and mental illness. Because you mentioned, we all have mental health, we all have bad days. It's okay to have a bad day, I guess, and, I think that's what we're probably all trying to teach our kids, that it's okay to feel sad, it's okay to feel anxiety, it's okay to cry. These are all normal feelings that we have, and then, if we talk about it, we try to process it, we can get through it. But for example, I have a younger son, and, when we're talking about, I feel like mental health is something that's overall, right? But mental illness is a little bit more specific, and that definitely need a diagnosis for it. You might need medication, you might need therapy. So if I were to take back this information that you have all shared with me to another community member and say that, it's important for us to establish a peer group that will hopefully be a judgment-free zone, because clearly that is one of the biggest taboos, right? Like if I sit with a group of peers and tell them that there are days that I don't feel very happy and I just want to look funky today, I don't really want to put any effort into it, and that's okay, right? Like I'm gonna say that's okay, but I don't know really what my peers are gonna say. But really to say we all have mental health, but then there's also mental illness, and that's something that needs a professional help. How do I describe that? How do I differentiate that for my community member that I want to discuss my takeaway today and share with her?
So I think that's what they were just talking about
Yeah.
there, where they talked about those signs and symptoms that are gonna interfere with your daily activities.
That was more
that-
like about suicide, sorry.
Well, but that's mental illness, it's the same,
Oh,
right? So you're gonna
gotcha.
see those things because someone that's struggling with depression is gonna go through that same cycle. And when those symptoms are lasting for an extended period of time, like we're not just a single day of feeling like, I don't wanna do it all today, I just wanna stay in my jammies, right? One day is great, a week, you start to get concerned, 2 weeks, then we're looking at like mental health things. So it has to do with like the duration and how it's affecting your life. Because if it's just been a day and you're like, oh my gosh, I must have a mental illness because I didn't feel like doing this today. No, that's just, you had a mental health day. It's okay, right? And so when it becomes that impact that's gonna be on your life that's lasting is when it's an issue.
So I take the signs that you guys just listed and share that as these are warning
Well-
signs for mental illness.
Go ahead.
They can't be, yeah.
Go ahead.
They can be, so I think what we're talking about is we're asking kind of what's the line between maybe having just poor mental health and then making it mental illness. Most of the diagnoses that we can assign as clinicians, there's a piece of it that says it causes clinically significant distress in somebody's life to where it's been disruptive enough, there's been enough consequences that it's really disrupting somebody's life. So being anxious, everybody in this room has probably been anxious before, has felt sad, has felt excited, has felt worried. But it's when it becomes something that's pervasive, it impacts their life in multiple situations. When we think of a pretty common one, PTSD, some people go through a traumatic experience and come out resilient and come out with not a whole lot of mental health concerns after that. Somebody goes through and experiences a lot of traumatic flashbacks and nightmares, and it's impacting them. They won't sit with their back to the door. They won't go outside, or else they'll have a panic attack. It's when something is, like we're talking about long-term, it's present in a bunch of different settings, and it's caused real consequences to their life. And they don't necessarily have to believe that they're experiencing consequences, because there's things like conduct disorder, there's things like substance use, where if the person doesn't recognize that there's been an impact, family members, sometimes legal people can determine that that's also had some sort of long-term impact.
And one thing I'm so sorry. One thing that I try to teach parents when they're asking that same question is, I want you to imagine a splinter. And on the first day, a splinter might be a little sore, you might have a little bit of issue, but you're going to go on with life. There's a problem, it is present, you can survive, you don't need any help. If you leave that splinter alone long enough, it might get infected, which then I now maybe can't use this finger. So every time I'm doing something, I'm held back. So if you think of it in terms of as it grows, the more it impacts what they do day to day, that is when I would tell a parent, you're crossing the line into a need. And I don't know that you can define mental illness because the perfect example, 9/11, we saw many people walk away and say, all right, I'm going to pick myself up. I'm going to help others. They did not have PTSD symptoms. We saw people that were miles away, hundreds of miles away, that watched it on TV that suffered PTSD. So I think what we have to do is you have to look at your child and you have to think, what's the level of suffering? When are they getting to a point that it is impacting what they're able to do? I can't go to school, or I can't get up on time, or I'm not showering, or I don't want to play with my friends, and apply that to individual children. Because for instance, I'm an introvert. If you look at me and how much I spend time with my friends, I would look like I have a mental illness because I like to be alone. You look at my older brother, the second he's not around someone, you're going to be concerned because he's an extrovert. So you have to apply what you know about the child and then look at when is it inhibiting their ability to do what they were before.
I think it all starts with the question being okay, the conversation being okay. So if I were running a community group, I don't think I'd bring signs and symptoms and any of that. What I would bring is warmth and connection and it being okay to have the conversation. And then if someone decides to take that conversation into a professional setting, that'll be their decision to do. They're empowered to do that. But empathy is where it starts. Empathy is where it starts. And that doesn't require signs and symptoms. It does ask us to be willing to listen.
Well, you know what, this conversation has been really rich, extremely rich. And I think we'll end on that note, but I like what you said about empathy. And I think if we do that, it not only opens up us to help us, but it also helps those that are around us. And so I have this sign that say, Angie, be excessively kind to yourself. And sometimes we have to remind ourselves of that too, because if I can't be kind, there's no way I'm gonna be kind to you. And so I think you all have done an awesome job. I really appreciate this. I'm sure everybody that listens to us is gonna wanna listen more. So if you would leave your cards, and I can make sure that anybody who wants to reach out to you, you forgot your card. If you want to reach out, then they'll be able to. But thank you guys so very much. Don't forget to get your lunch. If there's somebody that you guys want to talk to them for a second, they're here for a little bit. We only asked them for an hour, and I think we went over because it was such a rich discussion. And then Teresa wants to get our pictures together.
Yeah, if y'all can stand up here, we'll get a picture.
Thank you, everybody.
Thank you, everyone.
Thank you.
Thank you for being